Hi everyone, my name is Nicole Truitt. I am a grad student at Valdosta State University, and I'm currently enrolled in the Masters of Accountancy program. I graduated last fall with a Bachelor's in Business of Administration in Accounting and Finance, and I'm going to be doing a business presentation for you all today covering Piedmont Hospital. So just a little bit of history about the hospital itself. Piedmont was founded in 1905 by Dr. Ludwig Amster and Dr. Floyd Wilcox McKay. Piedmont is a private, non-for-profit organization, and it employs over 3,400 employees. It holds a medical staff of 1,054 physicians, and Piedmont also has over 385 volunteers. Piedmont Hospital is considered a 488-bed acute tertiary care facility, and it is located in North Atlanta in the Buckhead area. Piedmont specializes in heart health, transplant services, cancer care, neurology services, women's services and care, and orthopedic care. Some accreditation that Piedmont Hospital has is it is fully accredited by the DNV GL Healthcare, and this includes disease-specific certification for stroke. Piedmont Hospital also has its Level 2 accreditation in bariatric surgery, which recognizes Piedmont Atlanta for high-quality surgical care. Piedmont is accredited by the American College of Surgeons Commission on Cancer as an integrated network cancer program. And all of these accreditations just show that Piedmont Hospital can be trusted, and consumers are very confident in their choice of Piedmont. Along with its accreditations, Piedmont Hospital also has multiple awards and mentions over the past couple of years that also help consumers be confident in their decisions in choosing Piedmont Hospital. Piedmont Hospital is named the best in Atlanta for overall cardiac care, cardiac surgery, and coronary intervention in 2013. Piedmont was named the top acute care community hospital in Metro Atlanta in the 2011-2012 U.S. News and World Report's Best Hospital list. Piedmont Hospital is also ranked top 5 among Metro Atlanta hospitals in patient satisfaction scores, according to the Hospital Consumer Assessment of Healthcare Providers and Systems for the past 2 years. Some of the facts and figures from 2015 for Piedmont hospitals includes various numbers for each department within the hospital to give consumers and you guys a better idea of where most of their patients come from and where most of their service comes from. So in 2015, Piedmont had 3,533 newborn deliveries. It also reported 50,211 emergency department visits. It also has 22,123 surgeries, and Piedmont had a total of 291,549 outpatient encounters. Piedmont also reported a 27,321 inpatient admissions. And also, Piedmont is affiliated with more than 125 academic entities. There has been over 3,500 transplants conducted since 1986 in Piedmont Hospital, and more than 375 nursing students do their clinical rotations at Piedmont Hospital each year. Next, I'm going to cover my personal affiliation with Piedmont Hospital. First off, the location is in Atlanta, Georgia, where I am from. And I was also born in Piedmont Hospital in 1994. And throughout my years with Piedmont, my family's years with Piedmont, we've always had a high level of employee satisfaction and have always been overly confident in our nurses, physicians, and doctors that are employed by Piedmont. So I'm now going to cover Chapter 3 of the textbook that covers the current operations of the healthcare system. Chapter 3 touches on a number of topics, but just a couple of them that I'm going to mention in my presentation are the overview of all the factors that go into the healthcare system. It also touches on the complex system as a total of private and public, for-profit and non-for-profit entities. Chapter 3 also gives a brief overview of the stakeholders within the healthcare system. And it also covers the insured, uninsured, and underinsured consumers in the healthcare market. Underinsured meaning they don't have enough insurance to cover all of their costs medically for that year. Also, I think it's interesting to see that the United States healthcare system does not provide healthcare access to all of its citizens, which is unlike the other systems in the world. So that is different. Some of the healthcare employment facts that Chapter 3 touches on is the healthcare system employs over 18 million people currently, and it also has projected an estimate of 3.2 million more jobs by the year 2018, which makes a huge impact on our employment rates within the United States, just within this one healthcare system and market itself. Most healthcare jobs do not require a 4-year college degree, contrary to the popular belief, because some believe that if they're going to be doing operations and other stuff, it's not skills that can be acquired in everyday life. So they don't normally have to have a 4-year college degree, but they do need to be certified in the healthcare areas that they are employed in. Healthcare employment can mainly be found in large states like California, New York, Texas, and Florida hold the majority of the employment opportunities as opposed to the smaller states in the United States. The healthcare relationships that the chapter touches on, it says that the most important stakeholders within the healthcare system are the consumers and the providers, whereas health insurance companies, government programs, healthcare facilities, pharmaceutical companies, and laboratories all provide services to consumers to ensure that they receive quality healthcare while also supporting their providers. The peripheral stakeholders that don't really necessarily have an immediate impact on the main relationship, but are still important to the industry and the market as a whole, would be those of professional associations, research organizations, and medical and training facilities. Some statistics and numbers that are touched on in the chapter that I think are important for this presentation are that the healthcare expenditures comprise approximately 17.6% of our nation's GDP, and that is a large percentage for just one market to hold. That is huge for the healthcare industry and market. And also, in 2011, there was reported 48.2 million people that were medically uninsured. This was conducted by the CDC. And although there was 48.2 million that were uninsured, there was also a 29 million that were underinsured. And once again, that means they did not have enough coverage to cover their costs for the year. My article that I am introducing is over the patient alert, deadlock looms between Piedmont and United. This article introduces the concept that Piedmont will not renew its contract with United Healthcare. According to the article, Piedmont sent over 150,000 letters to patients warning them of the contract disagreement and foreshadowing that they will not renew the contract with United Healthcare. United claims that Piedmont is asking for a restrictive contract that would make it more difficult for United Healthcare and its customers to offer plan participants flexible health plan options and incentives that give people more opportunity to reduce their out-of-pocket costs. So basically, by stating this, United is saying that Piedmont was not willing to compromise in the situation. And according to Piedmont CEO Greg Hurst, the disagreement was over cost calculations. And Piedmont has claimed that each surgery, transplant, anything transacted in the hospital should have different costs based on the surgery. And United claims that each surgery and transplant should have a strict cost calculation to where patients know the cost before going into the surgery. Greg Hurst, the CEO of Piedmont, is pessimistic about a new deal. And this is very important because a lot of times hospitals and insurance companies get into arguments or disagreements over the new contracts and what they will compromise on. But when Greg Hurst released this statement, it's showing that he's not hopeful about renewing the contract. And that is why they went ahead and sent out the letters to the patients warning them that maybe the contract will not be renewed. Although Piedmont won't renew its contract with United Healthcare, there is over 520 Piedmont affiliated physicians that will still be considered in United Healthcare's network because they are under separate contract than the hospital. So what does this mean? If the Piedmont hospital does not renew its contract with United Healthcare, this means that hundreds of doctors will be considered out of reach for the insurance, members of United in Georgia. And if these patients that have United Healthcare insurance decide to continue to use Piedmont's facilities and physicians, it'll be more higher out-of-pocket costs for them at the end of the day. The problems that will arise from the contract end is the loss of consumers due to the out-of-reach insurance. As I mentioned previously, Piedmont sent out over 150,000 letters to patients warning them of this because those patients had United Healthcare insurance. With that many patients having that insurance and you losing contract, that's a huge risk for the hospital to take over a small feud like this and not being able to compromise. Consumers are not going to want to pay the out-of-pocket fees without insurance, so I'm sure they will not be pleased with the contract disagreement. Piedmont's competition definitely was thrilled to hear the announcement that it will not renew its contract with United because the competition hospitals can reap the benefits of this contract disagreement by pulling in those former patients. And maybe the patients will like that hospital better than Piedmont, and word of mouth spreads. And this can only mean higher rates of consumer income from competitor hospitals compared to Piedmont's through the loss of consumers. The emergency department visits, I think, is a very strong point. Within Piedmont, they did report a large number of emergency department visits, so some argue that Piedmont may not be too highly affected by the contractual end because of the large amount of emergency department visits. In the chapter, it mentioned that many uninsured and underinsured customers will report to the emergency department as a source of primary income since they don't have a healthcare insurance provider. But because of this, there's no way to ensure that those funds for each patient will come in. And so a lot of times the hospital is not compensated for the treatments in the emergency department. So this would be another risk that Piedmont would face if this is how it's planning to overcome the consumer loss. So for future decisions, depending on the impact of this, United Healthcare, Piedmont will need to consider if it does hurt the hospital financially. Piedmont may never develop a new contract with United. But if this if this loss is too great and it's hurting Piedmont financially, Piedmont will have to compromise with United in order to gain back those customers. Also, because the largest healthcare provider of insurance in Georgia is Blue Cross and Blue Shield, this may not impact Piedmont dramatically. So basically, only time will tell how Piedmont will need to change in order to make up for the loss. So the assumptions that will change because of this contractual disagreement is the amount of customers that Piedmont has. No one knows for sure if Piedmont will lose a dramatic amount of customers and patients due to this contract disagreement, or if it may not affect them quite as dramatically as people are expecting it to. I was pointing out the confidence and the comfortableness in doctors and nurses. Some patients are comfortable with Piedmont and don't want to leave because of this contract disagreement, and they may be willing to pay out-of-pocket expenses. So Piedmont may not lose all of the 150,000 patients that it sent out letters to, but it could lose some of them, and that would make a change in the normal operations that the hospital conducts daily. So if the change in the number of patients is dramatic, will the hospital need to alter the amount of physicians, nurses, and employees necessary to continue those operations? I think this will be another assumption that the hospital will need to change as well. Some of the questions that I have come up with through the article and through this presentation and for Piedmont Hospital. What type of impact will this have on the number of inpatient services that Piedmont Hospital takes in? Will it dramatically alter the amount of inpatient services, outpatient services? Will it have different effects on each of the departments of the hospital? And what will it do to other departments of the hospital? Also, with any consumer loss, how will this affect the general income of Piedmont Hospital? Will it be financially stable enough to incur this impact, or will it need to make adjustments to prepare for it? Will the hospital need to let go of some of the physicians, nurses, and employees? As I mentioned before, if it loses a lot of consumers and patients, it may be overemployed. So will they need to let go of some of their employees to compensate for the loss? Also, does it expect more emergency department visits because of the disagreement? A lot more people are going to be uninsured or underinsured if they choose to continue using Piedmont Hospital. And so are they expecting more emergency department visits? Meaning, would they need to employ more people within their emergency department? And how overall will this affect the emergency department within the hospital? Does losing patients because of out-of-reach insurance hurt morale among employees and patients? I know a lot of employee-patient relationships that are important to employees and the patients as well. And does losing certain patients and losing those relationships hurt the morale among the hospital? And what will this do for the hospital? Also, will Piedmont implement any new policies or procedures to overcome this obstacle and make up for the loss of customers and consumers? What if this does create a dramatic effect change in the hospital? What kind of changes will the operations within the hospital undergo to make up for it and compensate for the loss? All these questions are questions that popped into my head. I was reading the chapter and this article, and I hope that Piedmont is considering these and addressing these needs of the patients and the employees. And that concludes my presentation. Thank you all for watching. I hope you enjoyed it.